Okay, hello everybody. Sorry about that. I was just getting ready. So I'll ask the quintessential Zoom question. Can you all see my screen?
We can.
Okay, great. So again, everybody, my name is Aislynn, and today I will be presenting PAN, which is the organization that I work with and my experience with the organization. And before we begin, I would just like to acknowledge that the land that I am presenting on is the land which is the traditional territory of the Mississauga Anishinaabeg, adjacent to the Mississaugas of Scugog Island First Nation, and in the territory covered by the Williams Treaty. So I'm actually located in the last purple section of what is colonially known as Ontario, right there. So here I have my table of contents. What I will be presenting to you today is the summary of my practicum, the practice scenario, concepts and skills, call to action, my self-reflection, and a brief thank you to my team that I worked with. So the summary. So PAN was previously known as the Pacific AIDS Network, is now known as PAN, is currently located in what is colonially known as British Columbia. But it is run entirely remotely, which is amazing, and with all personnel working in different provinces across the nation. PAN works with over 44 member organizations that help support people living with HIV, hepatitis C, mental unwellness, and/or substance overuse. Oops, sorry. Are you seeing my, okay. What are you seeing right now?
PAN. Right now is PAN.
Okay.
Yep.
All right, thank you. So a summary of placement. So these are the 3 learnings that I was tasked with during my practicum placement with PAN. So my first learning was to increase engagement amongst 4 case study sites, which included 2 in Prince George, 1 in Victoria, and 1 in Smithers. And these sites this learning was to build a gray literature repository. And then my second learning, I don't know why it's, I must have timers on it, sorry. Let's go back. This is what you see. The second learning was my ethics amendment for survey development. And then my third learning was to develop knowledge translation and mobilizing tools while working with members from PAN, like personnel from PAN. So this is the practice scenario that was emerged with my work with PAN and is the Making It Work project. So it is a realist under the realist evaluation theory. Essentially, the Making It Work project was looking to understand how, why, when, and for whom programs work. And so that a program theory could be developed and applied to a general population or to a group, a subject group. So for the Making It Work project, in this case, it was seeking to support Indigenous community members to help integrate service models for people living with HIV, as mentioned, hepatitis C, mental unwellness, and/or problematic substance use. And it highlights what it does well is it highlights what works well for individuals and groups accessing the service. It is a very collaborative project. So PAN works alongside the Aboriginal HIV and AIDS Center at the Canadian Aboriginal AIDS Network. And this project used the following 3 program models to help bring it to life. So there's a 2-eyed seeing approach, a community-based research approach, and a realist evaluation theory approach, which I mentioned as the emergent scenario. So concepts and skills that I learned are garnered through this practicum experience were, as you can see, written and oral communication, interprofessional teamwork, project planning, cultural safety, and competence. And a lot of these skills were achieved through weekly meetings and just watching how my colleagues worked amongst each other and just collaborated on projects such as the ethics amendments, the gray literature, and qualitative coding exercises. Also, the values that I garnered were diversity and cultural safety, and to name one. And this was exemplified through participating in discussions that incorporated Indigenous service delivery models with an understanding of the diversity and commonalities within Indigenous cultures, such that their worldviews are seen as holistic for the individual and balanced between the individual and their connection to land and relationship. Also, there was critical analysis drawing on principles of social justice and equity, and community-based approaches to research and knowledge development, partnerships with people and populations served. I think I'm going over. Okay, and the SP knowledge areas that you can see here, they were garnered through working on multidisciplinary teams that desire to, and this, as I mentioned before, my colleagues desire to provide high quality services in health and community care to the communities and organizations that they help support. And this is done through ethical reasoning and cultural safety. Now, here is my call to action. So for my call to action, what really stood out was call to action 22, which was we call upon those who can affect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. And this is from the Truth and Reconciliation Commission of Canada. And how I plan to operationalize this call to action is by lending my voice to active advocacy when possible. As a professional in practice, I hope to work alongside Indigenous researchers and medical professionals and to help execute health clinics and research that would showcase Indigenous ways of healing, similar to that of the two-eyed way of seeing model. Two-eyed way approach. So here's my quick self-reflection. So I had two takeaways. Overall, I had a really great practicum experience and university experience, despite the challenges. My two takeaways were knowledge application and skills acquirement and cultural safety and community. I learned so much that I didn't even know before. And the key insights is that it helps with my career path, fine-tune it quite a bit. And also it reminded me that it's actually quite difficult to study online, but with the correct supports and services, teams, it's possible. So a quick thank you. I would like to thank the team from PAN that I work with. So this would be Janice Duddy, Jennifer Demchuk, Madeline Gallard, Alicia Kovac, Eddie Young, Furkan Walid, and of course, Heather, thank you so much for your support. And also, as for school, I just want to shout out Maddox Thorin and Fawn for their support as well. Thank you, everybody. This presentation was made by SlidesGo and Icons by Flat Icons.